congratulations, you're going on Medicare. This is a great opportunity for you. But since Medicare doesn't pay all the bills, you have to decide, or trying to decide, which way you should go. Should you go with a supplemental plan or should you go with an Advantage plan? That's the decision you have to make. This is especially important for people with health problems. For this reason, guys, when you go on Medicare Part B, you have 6 months. You are in open enrollment. During that time, no insurance company can turn you down. They have to accept you. But there's some things I want to make sure you do realize. Medicare Advantage plans will always take you. You can switch plans every year, different companies. In the fall, they call that, the open enrollment period. That is for Medicare Advantage and Medicare Part D, the prescription drug program, only. It's only for those two. Medicare Supplement plans, when you have an insurance policy with an insurance company, you only have one open enrollment in your life. That is the 6 months period when you're turning 65. So when you go on Medicare Part B and you turn 65, you have a 6-month window that the insurance company cannot turn you down for a supplemental plan. But let's look at something for you. Let's say a couple years down the road, you've been on Medicare a while and you're not real happy with your plan. Let's say you have an Advantage plan, but you have some health problems and you want to see if you can go back into Medicare supplemental plan. You can if you meet their health guidelines. They can ask you health questions. They will ask you health questions. They'll look at your medications and your health history. They don't have to take you. They can turn you down. So a Medicare supplement plan is very, very important, especially if you have health problems right now, because you're going to have to decide, do I go with an Advantage plan or do I go with a supplemental plan? Watch the entire video today, because at the end of this video, I'm going to give you a quick outline on how to buy these things. And that is actually very important for you, because the way you buy it and how you buy it and who you buy it through has a big impact. And also, if you like the video, please, down below, like it, dislike it, comment. I love comments. If you have something to say or questions, say it. If you need some help, you can write it in the comments and I'll answer you. Okay? Medicare Advantage, what are they? Medicare Advantage Part C of Medicare. It's basically an HMO or a PPO. Most of them are HMOs, health maintenance organizations. The health maintenance company, Blue Cross, United Healthcare, those are HMOs companies. They offer that product. They administer your health plan for you. What it is that you're still in Medicare, but you don't have the protection of Medicare anymore. You sign a 1-year contract with them. They manage your health care for that 1 year. Generally they will set up a network of doctors and hospitals. You have to use those doctors and hospitals. And it's a regional network. It could be just 3, 4, 5 counties where you live. So it's not something that's not a national network. If you are a snowbird, this is not something you really want to look at, because these plans are, you have to pick a primary doctor. You go to your primary doctor. If you have more need of more specialists, the primary doctor will refer you to a specialist. The specialist then will write up a plan, submit it to the insurance company, and the insurance company then will decide on the best plan for you. Medicare Supplement, on the other hand, is basically all it is an insurance contract between you and the insurance company. They promise to pay after Medicare. So Medicare pays a claim, the insurance company pays their portion of the claim. It's very simple. Pros and cons, which is good and which is bad. From my 25 years experience, I do favor supplemental plans for this reason, guys. Networks, you have to stay in a network if you have an Advantage plan. In a Medicare Supplement plan, the network is the country, the whole United States and its territories. You can go to any doctor and hospital. With an Advantage plan, you have to stay within their network. Out-of-pocket expenses. On an Advantage plan, you can have up to $6,700 of out-of-pocket expenses per calendar year. On a supplemental plans, at least the ones I recommend, you'll generally have about $183 a year. That's it. So with an Advantage plan, you can have very high out-of-pocket costs, especially, if you have something in the fall that's serious and you run up, you're out of pocket, and then come January 1, you have a brand new period, you can run it up again. So in any 1 year time span, you could be spending over $13,000. Treatment. I don't like the idea of an insurance company deciding the treatment. I don't like that. If you have something serious, I want it between me and my doctor, not between my doctor and the insurance company. The insurance company can come back and change that treatment however they want. I'm not saying they do, but they can. I've known people with these type of plans where they might need a CAT scan or an MRI, and the insurance company says, no, let's do physical therapy or something else first. They don't have to do that. In network, out of network. In network, Advantage plans, you're okay as long as you have no major health problems. But if you're out, on a vacation, or you're a snowbird and you have an Advantage plan and you have a serious illness, you have some problems then, because they have to treat you. But if it's an extended treatment of any sort, all they got to do is stabilize you, and it's up to you. It's your dime to get back within network. With a supplemental plan like I have for myself, I go anywhere I want in the United States. So if I'm in Florida for the wintertime and I get sick or I have an accident, I just go to doctors. That's all, and I don't have any problems. At the beginning of the video, I talked about, I would give you some advice on how to buy one of these things. This is very, very important for this reason. There's 3 ways to buy one. You can go directly with the insurance company, you can buy it through an agent, or you can buy it from someone online. First off, the insurance company. Don't ever buy one direct from an insurance company. They charge you the same prices like if you would go through somebody like me, an agent. It's the same price. The only benefit is that if you go through an agent or a broker, you're getting an advocate. You're getting somebody who's working for you on your side. Okay? If you go with an insurance company, they're not going to tell you if there's problems or if there's going to be a big rate increases. They don't tell you those things. A captive agent, another way. Don't go through a captive agent. A captive agent is someone who works for that company. They're an employee of that company. They can only offer you that company's products. And that company might have good products for some folks, but for your situation, it might not be the best one. They might be very expensive in your area. Or, in other areas of the country, they might be better, but stay away from a captive agent. Again, because a captive agent can't come back to you 2-3 years down the road and say, you know what, our premiums are too high, let's move to another company. They can't do that. Lastly is buying it online. I think that would be the best way to do it. And you do your research, you find somebody online, call them up, talk to this person on the phone. Now, be very careful when you do it online, because there's a lot of very high-tech agencies out there who have websites. They look really, really good. They have good information on a lot of them, but they're basically captive agents. They're selling you 1 or 2 or 3 companies. That's all they're doing. Some of these companies don't even sell you products. What they do is they collect your data. They're data mining companies. They're looking for your name and phone number. They want to take your name and sell it to insurance agents like me. I could buy those things all day long. I don't, but I could. The best way to do these things is find somebody online. You've seen their videos, you talk to them, interview them. And if you feel comfortable with them, that's the type of person, because you want someone, an advocate working for you, not working for an insurance company. So I hope this has helped you. If you have any questions, down below you can type it in, or you can give me a call. I'm available. I'm the only one that answers that phone number. I don't have a big staff, guys. There's only a few of us working in this, and we all answer our own lines. So I hope you like this, and have a good day.